Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about managing bipolar disorder with nutrition and supplements. Bipolar disorder is a chronic and recurrent mental disease that was once referred to as manic depressive illness. Bipolar disorder has a lifetime prevalence of 3 to 5% of the population. Bipolar disorder is also often associated with impaired functioning in various areas of life, including personal, family, and social, also occupational. Now, bipolar disorder is a somatic symptom disorder, which means that it is a mental disorder that manifests as physical symptoms that can cause disease or illness. And bipolar disorder is associated with a high incidence of obesity, type 2 diabetes, heart disease, and stroke. And these health conditions also negatively impact the course of the mental illness. Bipolar disorder reduces life expectancy by as much as 10 to 20 years compared to the general population, and it is a major disability to most people who suffer from it. Bipolar disorder varies in severity and episodes of extreme highs and extreme lows, and the person suffering from the condition may feel hopelessly depressed at one moment and then overly elated the next moment. While medications are currently the principal treatment for bipolar disorder and can help stabilize extreme mood shifts and unpredictable activity levels, they can have adverse side effects that can also frequently increase the risk of heart disease. Fortunately, natural remedies involving better food choices and dietary supplements can play a role in managing bipolar disorder symptoms. For the brain to function correctly, it must have sufficient energy and specific nutrients. Therefore, a person's nutrition and eating habits are closely related to the development and progression of many mental disorders, including bipolar disorder. For example, it is well documented that patients suffering from bipolar disorder and those also with type 2 diabetes or glucose intolerance show a greater risk of suffering from chronic bipolar disorder rather than people without glycemic control issues. Now, also dieting, ongoing dieting, on and off dieting, and other reasons for weight loss or weight gain are associated with incidence of manic and depressive phases. Studies show that dietary habits may cause and sustain conditions associated with bipolar disorders such as inflammation, oxidative stress, reduced neuroplasticity and neurogenesis of brain cells. Now, 1 in 3 people with bipolar disorder also meets the criteria for binge eating disorder, bulimia, and other variants of these eating disorders. Now, here are some foods and nutrients that I want to talk about that and changes to lifestyle that you can consider to support you if you are suffering from bipolar disorder. Number 1, you want to reduce food intake, especially sugar and simple carbohydrates from your diet. People with bipolar disorder showed significantly higher intake of total energy, simple carbohydrates, protein, sugar, and saturated fats. Now, these foods increase inflammation in the body, which is a marker of many diseases, including mental health disorders. Therefore, although you do want to consume carbohydrates, you want to be consuming them as whole carbohydrates, such as whole grains, fruits, and not fruit juices, potatoes, and other root vegetables that are baked and not fried. You want to avoid adding refined sugars to your foods and your drinks, and also avoiding foods that are rich in added sugars such as candies, cakes, and other processed and unwhole baked goods and sweetened drinks. Now, you also want to consume sources that are rich in zinc. Zinc improves enzyme function and cell division. In a study led by Jessica Wang of the University of Pennsylvania School of Nursing, researchers reviewed the evidence supporting the role of zinc deficiency in increasing depression symptoms and manic episodes, and zinc shows to be a robust antidepressant. Zinc deficiency increases the risk of depression, while supplementation with zinc is an effective treatment. Consistently, zinc deficiencies were observed in 41% of psychogeriatric patients, including depressive disorders, compared to a 14.4% of the control population, the control group, that demonstrates this deficiency. Now, it has also been reported that there is decreased cell survival in hippocampal regions of the brain when there is zinc deficiency. And also, zinc downregulates brain-derived neurotrophic factor, BDNF, activity, and there is evidence that shows a connection between BDNF and depressive disorders. Now, you can see my video on BDNF to see how you can increase the activity of this growth factor. And you want to supplement with 15 to 30 milligrams of zinc daily to work as an antidepressant in the supplement form. The National Institute of Health recommends no more than 40 milligrams of zinc, so make sure that you're not going over this amount. Excellent food sources of zinc include legumes, especially baked beans, chickpeas, nuts, especially cashews and almonds, seeds, and whole grains. And vegetables that are higher in zinc include spinach, mushrooms, and broccoli and kale. And if I'm mentioning BDNF, a high-fat Western world diet has been shown to lead to decrease in BDNF expression in the brain and a deterioration of the quality of new hippocampal cells, neurons. You also want to be eating omega-3 fatty acid rich foods. Omega-3 fatty acids are essential for brain development and function. Omega-3 fatty acids are long-chain polyunsaturated fatty acids, and unlike saturated fats, which have been shown to have negative health consequences, omega-3 fatty acids have been shown to have many health benefits, including mental health benefits. Mood disorders have been associated with abnormalities in fatty acid composition and diminished omega-3 fatty acid levels. Omega-3 fatty acid rich foods are low in the Western world diet. Consuming foods high in omega-3 such as chia seeds, green leafy sea vegetables, walnuts, lettuce, broccoli, and other green leafy vegetables increases levels of fatty acids in the blood and travel across the blood-brain barrier into the brain. Due to its anti-inflammatory properties, omega-3 fatty acids have been shown to relieve depression and manic episodes. According to the research on the effects of omega-3 supplementation on bipolar people suffering from bipolar disorder, consuming omega-3 fatty acids may help prevent recurring mood disorders. And this conclusion came after observing omega-3 fatty acid deficiencies in the blood and brain tissues of patients with bipolar disorder. Now, several epidemiological and intervention studies have shown the relationship between the consumption of foods rich in omega-3 fatty acids in diet or through supplementation and the occurrence and severity of depression. And there are also studies showing that it is advisable to increase the content of this omega-3 fatty acids in the diet of bipolar disorder people in the treatment of depression. And doses go from 1 to 2 grams of eicosapentaenoic acid, EPA, a day. And these have been shown to reduce symptoms of depression, including bipolar disorder. Now, omega-3 fatty acids also have no side effects, and their consumption is beneficial to general health, so you do want to consume them. Now, you also want to look into vitamin D. Many studies have confirmed the association of low vitamin D levels with depression. They have demonstrated the efficacy of vitamin D supplementations in reducing the symptoms of depression in patients with clinically more severe depression states. Now, there are very few studies on the role of vitamin D in patients with bipolar disorder. However, it has been established that vitamin D deficiency in patients with bipolar disorder is 4.7 times higher than in the general population. So since also most of the population is deficient in vitamin D during winter months, I do recommend taking at least 1,000 international units of vitamin D3 daily. You also want to monitor your salt intake. Lithium has been used for decades and continues to be the standard treatment for bipolar disorder. However, if you're taking lithium for your condition, then you should be careful about your salt intake. You have to maintain a healthy balance since sudden spikes or decreases in sodium consumption may negatively impact lithium levels in your blood. So you want to avoid a low sodium diet as it may lead to lithium toxicity. It increases the lithium in your blood, and you want to increase fluid intake to prevent dehydration as well. Now, you also want to reduce your caffeine consumption. A person who has bipolar disorder may rely on a boost of caffeine to re-energize, especially when feeling depressed, but foods and drinks high in caffeine, including coffee, teas, certain teas, sports drinks, energy drinks, and chocolate have been shown that the high intake of caffeine from these foods and drinks may lead to heart palpitations, blood pressure fluctuations, and headaches. And this restlessness may result in sleep disturbances and insomnia, which can trigger a manic episode. Now, also, caffeine is absorbed by the gastrointestinal tract very rapidly. It quickly passes through the blood-brain barrier and increases serotonin levels. So this actually helps you feel good when the serotonin levels climb. But depression and other behaviors may come once you stop drinking. While you're drinking, you may get this high of serotonin, but when you stop drinking the coffee, between cups of coffee, the brain enters a withdrawal state and the neurotransmitters decline. And this leads to depression, state of depression with low serotonin levels. So therefore, it's wise to just avoid coffee consumption and anything that has high caffeine levels. So although it may make you feel good, this feeling is temporary, and it's good to know that after 10 to 14 days of no caffeine, your body will return to baseline levels of good feelings without coffee. And you can also increase your serotonin levels with omega-3 fatty acids, which do that. Also, essential oils such as bergamot and lavender and lemon that you can spread around the house will have been shown to increase serotonin levels. And also exercise of 30 minutes of endurance exercise, such as walking, biking, swimming, or running, also increase serotonin levels. Now, also, since we're talking about lifestyle, then obesity and inactivity are associated with depression and a worse course of the illness. And also treatment, non-compliance with medications, and significantly more depressed states with people with bipolar disorder. Therefore, exercise can enhance the mood of people with bipolar disorder, and it is essential to state that exercise doesn't need to be sustained for long periods, and it doesn't need to be extreme. So it can be more casual and maybe last for 20 to 30 minutes. You don't need more than that, and still have these major benefits on bipolar disorder. So I recommend exercising 5 days a week for 30 minutes each day, even walking. Now, also mindfulness and cognitive behavioral therapy, CBT, are very supportive in changing thought patterns and changing strategies for problem solving and supporting and making better decisions, such as better food choices, exercise, committing to an exercise regime, and also reducing caffeine and smoking, and having better sleep. Now, also, support is very crucial. Unfortunately, a holistic approach is necessary, but very difficult for people with bipolar disorder to comply to during the period they are suffering because of their unique needs and having a lack of motivation and higher rates of substance use as well. So sometimes there is need for an ongoing support system of a caretaker or a family member to support them in overcoming these difficulties and help them improve their situation. So, to summarize, people with bipolar disorder should be supported in considering alternative treatment methods to help manage symptoms, such as eating a healthy diet, monitoring sodium and caffeine consumption, exercising daily, and taking dietary supplements, and in behavioral and habit-changing support. So I hope you found this video helpful. If you did, please give it a thumbs up. Please also subscribe to my channel and visit my website, thegorilladiet.com, for anything to help you move your health and wellness to a better place for you. Thank you very much for joining.